Well, hello everyone. This is John from OSP, and we can wait another few seconds, make sure people come in. We want to welcome you to our webinar with Michael Rucker. And today we focusing on what Michael has to offer, and patients, including those with chronic health issues and the elderly, tend to have health goals. Now, doctors and patients may design a routine that needs to be followed to achieve targets, but often physicians have no idea if the prescribed routine of diet and or exercise is being implemented. And in our last webinar with Jill Bash, we spoke about the need to simplify patient-provider communication to reduce communication gaps. Today, we're happy to have Michael Rucker, a digital influencer and an author, to talk about the need for using innovative virtual health solutions to help patients achieve their healthcare goals. We'll also discuss which digital health tools can be used for monitoring patient health status. Now let's hear about Michael's thought on how virtual health can enable physicians and patients achieve optimum health conditions. So welcome to the webinar, Michael, and thank you for joining us today.
Thank you so much for having me.
So for everybody, we're going to start with a set of questions and a conversation that Michael and I will have. And a little later on, we're going to stop and have you, the audience, add whatever questions you want to ask, and then Michael will answer them. So to begin, congratulations, Michael, on publishing your book, The Fun Habit.
Upcoming. It comes out next year, but thank you.
Oh, sorry about that. For some reason, it's so much top of mind. So you've also been selected as a HIMSS digital influencer. So could you tell us about your experiences as a change maker?
Sure. Thanks. And yeah, it was an honor to be selected for that group, and I feel humbled and grateful to be part of such an esteemed group. And again, appreciate the accolades on the upcoming book. Being part of the Changemaker cohort has been an amazing experience. I think HIMSS did a really good job sort of creating a well-rounded group and selecting us all from different disciplines within health and health technology. And I believe the reason I was invited really was to contribute as a voice in expanding and defining what the continuum of care means. So me personally, I'm a CDO within a health group. We're part of the Providence Ambulatory Care Network. But just for the audience here, to make the distinction, us active wellness being considered part of the ABN is a little bit progressive, because actually even as early as this last week in the LA Times, there was really interesting discourse in our space right now about the ethics of identifying and prescribing medical intervention to individuals by identifying some predeterminants and the benefits of preventative care, right? Whether there's a stigma if you kind of get in front of condition-specific problems. So these are important conversations, and I feel honored, that HIMSS has kind of let me be that side of the voice as part of the Changemaker cohort.
It's great, thank you, Michael. Now, every Changemaker has a story to tell. Would you mind sharing something that inspired you to make a difference in healthcare?
Definitely. So it's kind of a big, landmark event for me. So what's had the greatest impact is the loss of my little brother. So he died, unfortunately, in 2016 at the age of 41 as the result of a pulmonary embolism. And so to some degree, that medical event happened because of his poor lifestyle choices. He certainly most likely had metabolic syndrome, but he also, at some point, sort of also decided that he wasn't going to pay attention to certain aspects of his health. And so to the extent that, my continued work can have an impact in helping people live healthier lives, his memory, and the things that I may have been able to have done, to help him, help drive that. So personally, his passing has affected me, not just in the sense of the work that I do day to day, but also just to be a little bit lean into some authenticity. It also took a toll on my mental health. So that's the theme that's interwoven into the book coming out next year. The fun happened, as I mentioned, since it's been, especially during the pandemic, abundantly clear that, our corpus of health involves both mind and body, and those are sort of, intimately connected. I become increasingly inspired to play my part in helping support both areas, especially in preventative ways.
Wow, that's certainly a journey that you've been going through. We've all noticed how healthcare currently is going through many transformations, and at the same time faces many challenges as well. And doctors are often unable to monitor patient health status. Can you share some of what you've learned about which digital health devices are gaining popularity for keeping track of patient health?
Sure. So this is a really interesting question. And so to be quite frank, I'm not sure we're actually at a place yet where physicians operate from environments that allow patient monitoring, quote unquote, to be advantageous. And so let me qualify that answer in a couple of ways. So one, many of these devices have suffered a lack of empathy for the end user. And so when I say the end user, I'm talking about both the physician, right, and the patients. So I think most of the folks on this call that have been following digital health will know, when EMRs came online, one of the things that wasn't really found out until they'd been implemented for years is that they really didn't augment the physician experience. In fact, what they did was increase their workload by 30 to 50%, right, as soon as they were implemented. And so when we look at these devices, especially trying to be empathetic for the physician, a lot of times we're not taking into consideration that longitudinal monitoring actually takes a lot of time, right, and could further lead to physician burnout. And so, what a lot of these digital devices have done is systematically deprovision what the doctors can do. And we're not just talking about EMRs, we're also talking about, many of these IoT at-home devices that are coming online, right? So that's one big aspect. And I will, finally get to the question, but the other one that I have intimate knowledge with is that there are legal barriers that still present huge roadblocks, right? And so I'll give a specific example. I was working with a particular hospital group that that I won't name just for the sake of it, because there's nothing nefarious here, but, and there was a really meant intent to port in EKG information so that doctors could monitor cardiac health. It was an intervention that we were able to deploy. And so we could provide that corpus of cardiac information and port it right into the MR. And we had, a great physician advisory board that was totally open to the idea, because we were still thinking about it from a whiteboard context. And so we had gotten, from the discovery phase into the design phase where we were actually already, looking at, how the APIs were going to work and, the middleware that needed to get done. And so as we were going through this design process, we got to a phase where ultimately the hospital group brought in some legal counsel and also some business advisory about, how this was going to evolve. And one of the lawyers had asked, okay, so, these devices, are they able to tell whether a cardiac event is going to happen, sort of predictive nature, or has happened? And will that data be stored in the EMR? And when we indicated, of course it will. In fact, that's one of the advantageous, aspects of this piece of technology. They said this absolutely can't happen. Because there is no way that the physicians can actually do the monitoring. And if the patient was able to find out that there was, some sort of ability to find out that a cardiac event could happen in the future, and that was stored in the EMR where the physician had access to it and then didn't look at it, they would be culpable. And so the whole intervention had to be shut down, right? And so there's some, they're surmountable, but there's some really significant headwinds that we're still facing today, right? And both of those are very important to think about and not talked about enough, right? And so I still haven't answered your question, right? So let's do that. So I do think what will ultimately happen is that we'll find that, and I might be biased because I do play more on the upstream side, is that consumers will ultimately end up driving that innovation, right? So to some degree, we're seeing that with Apple. That's why they haven't been super aggressive of getting FDA approval, because as long as it's not medically, doesn't play in that space, they can break more eggs, right? And so I think you're going to see, we certainly are seeing it with AFib and the Apple Watch. You're going to see these devices being integrated in things that are already getting used, and then figuring out applications within the middleware where these sorts of things can be teased out in a reliable way through either AI or machine learning, so that ultimately what becomes copable is the device itself, and then that information can be sent to the physician, so that it's not monitoring per se, but that it's creating something actionable that doesn't add additional workload to the physician, but then is also adding value to the patient experience. So,
right. Well, thank you, Michael. This was a very comprehensive answer. Let's look at a moment on the other side, on the patient side. From your research and what you find out, how valuable do you find a contribution of digital health in helping patients achieve their healthcare goals? Because once they buy into it, and after that communication between patient and physicians, then they set goals, and so how helpful has it been to really encourage the patients?
Yeah, so I think in that regard, especially when the device is paired with a condition, it's extremely advantageous, right? And so in my experience, the success of these tools really comes down to one thing, something that I like to call contextually relevant, or contextual relevance. So what does that mean, right? I mean, I love that word, but ultimately let's unpack it, right? So what it means is the tool a good fit for the condition the individual is trying to mitigate or improve? And so to do that, to make sure it's contextually relevant, we need to do a few things, right? So first and foremost, we need to look at health equity and see if they're, especially if we're talking about aging well, or populations that might not necessarily have an aptitude for technology, is there a digital divide concern that we need to address? And so that's one. And then ultimately we need to think about patient empathy, right? Like, is the device usable for that particular user? So has it been made in such a way that it's not so esoteric that ultimately it does what it's supposed to do, but the patient's never going to use it because you never got the patient involved? Something from my side of the fence that's often talked about is heart rate monitor straps. So ultimately, that's one of those conundrums where it's a very gender biased device, right? Like, if you're a male and you wear one, okay, this is great, right? But ultimately, that you get into focus groups, and oftentimes that type of device is really uncomfortable for the female. And so, we've been looking at, ways to improve that. And, that's just one micro example of many examples where ultimately you haven't started with the patient in mind. And so, ultimately the device won't contribute value because, it was engineered well, but it's not going to get used. And then also, have you involved the physician? Because oftentimes, they're the first, especially in a medical context. So on the other side of the fence, if a lot of times adoption and the value of it will be driven by the physician referral, right? But physicians aren't going to refer things that they're uncomfortable with, or they don't have knowledge of. So ultimately, also starting with them, to figure out what that looks like. And then how comprehensive is the onboarding, right? So, this is sort of a roll up of the first three things that we talked about. But as long as the device is usable, how have you trained, the end user or the patient? And I say end user just because, in my line of work, we don't start with the patient, right? So, but the end user or the patient, is comfortable with it, because a lot of the times we'll talk about certain groups not adopting things, and I won't call any single group out, but ultimately all of the groups that have problems with adoption, it actually, when you peel back the onion, it ends up being an onboarding problem where you haven't, you assume that they're going to know how to use it, but you haven't spent the time to. And you actually look at these programs longitudinally, and you find if the onboarding was well, that a lot of the groups that you thought had an adoption problem are actually the ones that are the most loyal users. And that was really just, your problem and you didn't onboard them right. And so one of the groups that I'm seeing is doing really well in this space is Ochsner Health. They have something called the O-Bar, which is an installation. In fact, I did a little due diligence getting ready for the webinar. I found out that during the pandemic, because people couldn't come to these installations, they've actually created a mobile experience as well. But it ultimately does, checks all the boxes of what we just discussed. It pairs the individual, whether that was through a prescription from a physician or whether, from the B2C side, whether someone sort of opted into a program. So we're talking about programs like maternity. We're talking about programs of IoT home monitoring, for the aging well, where they have, difficulties coming in to see a physician. And then we're talking about upstream stuff, like just trying to stay healthy or, avoid diabetes because it's been determined that you're pre-diabetic. And so they'll pair you with the right device and then, ultimately teach you how to use it until you feel comfortable with it. And if you have any questions, there's actually a real person on the other side, able to walk through it instead of you, having to suffer through sending an email, to a black box. And so that's where things get really powerful. Where have I seen value is, in those things, again, where you're pairing the condition and finding ways to help someone through that health journey.
Right. Well, this ties well into my next question. You mentioned one device, but have you experienced other devices that would allow doctors to receive notification of specific health risks?
Yeah, so again, my expertise really lies in devices that cater to upstream wellness services. So I feel a little bit unqualified to answer this particular question, but at the same time, I think, folks like Active Wellness are in a unique position in that regard because our practitioners have early access. And I meant, to be quite frank, better rapport than most physicians are going to have, because we see folks week after week, right? And so we're able to, over time, build that type of relationship, where there's, where we just have more opportunities and better touch points than you might have in traditional medical care. So for instance, where I have seen, this is probably one of the most established one is through wireless weight monitoring. We can use that as a big remediation intervention for cognitive heart failure, because if you see big influxes of weight, especially if someone has congestive heart failure, if you know that someone has a congestive heart failure issue, you can use that type of daily weight monitoring. And if there's huge fluctuations, then you can send an alert to the physician and a lot of times get in front of a cardiac event. And I'd already talked about the other cardiac intervention that I was involved with. And so as these devices are getting democratized, we're able to do more and more interesting things, right? Certainly another big one that's talked about in the last couple of years is AFib and fall prevention with the Apple Watch, right? And so as the ubiquity of these devices get integrated into the things that we already use day in and day out, they're going to get more interesting. And then also, again, to use that word democratized, we're seeing things that were traditionally, again, on my side of the fence, that were traditionally not accessible, to someone like an allied healthcare provider, something like musculoskeletal ultrasound, that can now be used, in a setting where it's more accessible to the person because it's cheaper, and also in a place where they might not necessarily have to wait around, right, where they have more ubiquity to access the care. And you can use things like that to assess and, in that particular instance, some of our installations are using ultrasound to be able to tell someone that they've worked out too hard. And so again, getting in front of a potential medical event where, hey, you don't have any glycogen left in your muscles, so if you keep running, what's going to happen is you're going to see your doctor. So that allows us to remediate, our own healthy intervention and avoid a medical intervention by saying, this is really a week for recovery. And that's not us just telling that, we can show you through the use of health technology that you're about to really get yourself in trouble. So, it really is exciting. Again, to answer your question in sort of discrete bullet points, one, that these devices are getting interwoven into things that are ubiquitous. And two, we're able to get ahead of a lot of conditions that may happen because more and more folks are going upstream. Like, I don't know if you know this one, I now wear this as my wedding ring, but it's the Aura ring. And so I get 24/7 heart rate variability monitoring just by wearing my wedding ring. I meant that, before I had to wear 3 big patches on my heart, right? I mean, yeah.
This is really amazing. And you already started answering what your company, Active Wellness, does with Upstream Care. But maybe you can tell us a little more, maybe a comprehensive explanation of the purpose and different application. And I know you already covered it somewhat, but to tell us the full picture of what you focus on with Upstream Care.
Yeah, so Upstream Care is really providing services before someone needs or is ready to see a doctor, right? And so it encompasses services like, the baseline is sort of fitness delivery or, getting someone active again. But it's really encompasses any services provided by an allied healthcare professional before someone is sick, right? So what we try to do is intervene, before someone would need medical assistance, before they're quote unquote termed a patient, or before they would need to see a physician. And so we try to meet individuals where they are, by skill building and, creating healthy routines and habits. So hopefully they never become a patient, right? And so, in addition to sort of supporting well-being and a lot of the things that people are probably most familiar with, I think where our efforts lie with regards to, looking to the future, especially, trying to remediate some of the impact that the pandemic has had, with some of the most vulnerable, is folks facing potential, mental health issues, and also folks that are aging well that don't necessarily want to get out of their house or self-identify with those types of things, right? And so we do know that, getting someone active again can be a really good first line of defense for low-level mental health issues. So we're looking at ways, where we can get ahead of that before, someone is really, might potentially need the service of a physician. And then again, with the aging well, folks that aren't necessarily ready to come out of their house, how can we use virtual offerings with the help of different IoT devices so that we can get folks active within their house until they're ready to get out, because that has a whole host of we've been kind of working hand in hand with the World Health Organization to find out how to re-engage folks that have really picked up sedentary habits, and that's another kind of untold consequence, is that we do know that's happening. We really haven't done, initial research is indicating that it's going to have some big consequences with regards to healthcare. And so we're trying to see how can we, soften some of that blow by just doing whatever we can to, again, get upstream and get people moving again before they, need more expensive medical care.
Yeah, this is a great segue into the next question, which is related to COVID-19 situation. And of course, it's created a lot of transition in healthcare. But have you found that, to the point you just made, that it's difficult or easy to convince patients to use digital technologies? And if it is difficult, what kind of strategies have you been using to change their mind, or have you seen that work?
Yeah,
to keep them healthy. And yeah.
Yeah, no, so I think you kind of alluded to it. I mean, it's a heady question because there's such a wide breadth of different available health technology, right? So it's kind of a hard question just to jump right into. But as a general statement, I would say it's not, kind of going back to some of the things that we've already discussed. The best ways that I've seen to inspire someone to adopt technology is to provide them value, right? I mean, so ultimately, especially people that have a condition already, they're highly motivated. And so as long as you pair somebody with the right device where you can indicate immediate value to that person, then adoption usually is generally easy, especially if you have an onboarding program. And then meeting patients where they are, right? So again, I kind of sung the praises of the Ochsner of, if they're not able to come in, do you have the ability to, meet them at home? Or if you do need to mail them a particular device, do you have a way, to get them involved? And sometimes it's not a technological solution, right? So we've seen, where you identify a primary caregiver and you get that person onboarded so that they can become your advocate, and ultimately bring that person with you. We see that especially, when we're looking at issues with cognitive decline and things of that nature. Outside of my experience with active wellness, I've worked for companies that, have created remediation with regards to cognitive decline. And, so one of the best strategies, again, is to identify someone that can be your advocate, so if there are any challenges, you're working sort of as a team. And then ultimately, leaning on my background as a behavioral scientist, finding any ways to remove sort of friction that's in the way, right? And so, unfortunately, a lot of times, especially for folks in technology, we want to be additive when we think about strategy, right? And so a lot of times, again, starting in a place of patient empathy, you look at a particular situation and trying to instead add something, right? Like, so should we add more instruction? Should we add steps to the onboarding? Are there things that are actually getting in the way where we should remove them, from the protocol? Because ultimately, one, it doesn't provide value, and two, it just adds, further cognitive load. And so, yeah, those are sort of my 3 bullets for that question.
Yeah. It's interesting because from everything you said, I think there is also that element that we discussed in the previous webinar, where if the physician engages a patient about their opinions, about their own health, and really engage them to share with them how do they feel, what do they think works, and there is that buy-in for patients to be really more kind of bought into communicating with the physicians and actually following their advice. There is something about that communication which cannot be just one way. It has to be 2 ways. And I know many studies show that when patients feel like they're being listened to, there is much more buy-in and success. So this is really interesting. And I'm not sure how it relates to the next question I have for you.
Yeah, but before we move, I do want to validate your thoughts there. So as part of my doctoral work, my background's in organizational psychology, but one of the things that, when I was drinking from the fire hose with regards to physician burnout that blew me away was one of the first ways you can tell whether or not a physician is burning out is their lack of empathy for the patient, right? And so, that's something that we've already addressed needs to get fixed, on the burnout side. But the second component of those studies is the really interesting connection to patient empathy with regards to outcomes, right? Because as soon as you can see that patient empathy goes down, outcomes goes down. So you're exactly right. You hit the nail on the head that when you're able to create something that feels like a partnership. And so ultimately, again, right, I always kind of stress this, but we haven't yet, in this conversation, is that these really are tools, right? They're meant to be something that's additive and not necessarily a replacement for care, which I think was an interesting paradigm we had, as we were looking at, trying to scale things, maybe 5 or 10 years back. We're now not doing that because we know it's maladaptive, right? But if you can use these tools to create a partnership, hopefully reduce the load on both the patient and the physician, but then also, to your point, create these bonds of a relationship where they feel, where the patient feels like they're a partner in their care, then absolutely, you'll see, one, empathy goes up. So again, a correlation to better outcomes, but then two, that buy-in, we know, creates higher engagement. And so, to the extent that the tool is useful, the patient also uses the tool more.
Right. So since now we're focusing a little bit on the patient, you published a very interesting paper in 2016 on ethical issues and challenges related to nutrition. So can you tell us, tell our listeners how nutrition and ethics in healthcare are related?
Sure. So you guys dug deep for that one.
Well, this is you have some expertise that would be interesting to share.
Sure. So the crux of that paper lies on, how we allow advice about our health to get disseminated, right? And so the lessons that you can glean from that paper that potentially could be applied to healthcare, really lies at, the crossroads of marketing and ethics. And so it's my belief that care in general should always start from a place of empathy. We've discussed that a lot throughout this, for the person that's being cared for. And so in the paper, we looked at how eating habits have been influenced in various ways, through marketing, through lobbyist groups. We kind of looked at how the Quakers had quite an influence in a non-scientific way, not necessarily qualifying that as bad or good, but that, that there were various non-evidence-based forces at play that have affected, the way that we eat over time. And so I think how that relates to healthcare is sort of in the same vein, right? We do know that ultimately pharmaceutical interventions are often influenced, by following the money, right? And you can see that certain drugs that have lower efficacy are often more prescribed because ultimately they had a better marketing arm than their competitor. And so I think, to answer your question discreetly, it is, as one of the benefits that we have today is that we really do share information more openly. And so, having gatekeepers and things of that nature of really keeping our industry honest about, whether things are in the best interests of the patient or the individual, versus things that are being, sort of force fed to us because, they're forces with leverage, power, or money behind them. And so thanks for that. I liked getting a little off topic from health tech, but yeah, it's an important thing. Especially in that paper, right as it came out, a lot of, of the issues of the sugar industry and how that's affected, the narrative with regards to especially the Western diet, and corn subsidies and things of that nature. You can certainly draw a dotted line to some of, some of the pharmaceutical crisis that we faced over the last decade as well.
Yeah. We have some questions who are starting to come in, but before we start answering, maybe from your point of view, can you share your view of the future, like looking 3-5 years down the line? What could patient wellness look like? And do you think more patients will adopt digital health tracking apps?
Yeah, so I guess, in the course of this, my hope is that in a half decade from now, we're not even talking about patient, right? So you'd ask me this question, what would wellness look like, right? Because my hope, if folks like, active wellness are doing their job, that we're starting to lessen, sort of the patient journey and create more of a wellness journey. And so, my hope is that we're looking at things in a more holistic way. With regards to digital health, looking at groups like ourselves and a group called Forward out of San Francisco and others that are really trying to redefine what the continuum of care looks like. My hope is, again, that the ubiquity of these different devices, sort of become so useful to us that ultimately we are creating that partnership in our own wellness journey. And so we're able to get in front of things because we're being nudged in effective, helpful, and empathetic ways that we can, change course before, things become a medical condition. I don't know that we'll get there in half a decade, but we're certainly heading in the right direction. And so, to the extent that we can become true partners in our health and in our care, that's my hope for the future.
That's great. Thank you. Well, Michael, really, thank you very much for spending all this time with us, sharing your insights. And so we wish you a lot of success 2021. Now we can start looking at some of the Q&A and comment. And before, one of them is obvious. A lot of people seem really interested in that ring. How can they find it? Maybe you can post it, or we can follow up, or you can tell us now. We're not trying to promote any product, but obviously this is very
I have no I have no dog in that fight, but I'm happy to share it. And it's called the Aura Ring. I got it because during the pandemic, unfortunately, I got insomnia. It kind of came out of nowhere, and I had some onset insomnia, as a doctoral student, probably just because, that's what happens when you study too hard. But I started having maintenance insomnia, and so it was a real blessing. And actually, I think that was one topic that we were going to try and get into that we sort of skipped over. But this idea of, virtual health, promoting better health outcomes as well. That's why I got the device. So to answer the questions out there with regards to what it is, it's called the Aura Ring. I think they were just in the news last week because I think they just had a major round. It's really cool. You should, for whoever's interested, check it out.
How do you spell Aura?
Aura, O-U-R-A.
Yeah. I was hoping it wasn't horror.
Yeah, the horror.
It's my French accent. So, well, we could look at some of the questions, and then we have some additional one, if you will. But
sure.
Some of the questions were about home care settings. What kind of a experience or wellness devices are coming out specifically from home care use. Any insights that you've gathered?
Yeah, I mean, for us, we're looking at things that provide that type of feedback. So we're using the AliveCore one for heart monitoring. All these are going to be consumer devices. We're looking at some devices that are able to track sleep frictionlessly. So Aura would be one of them. And then we're also looking at, I forget who they get acquired by because their name changes quite a bit, but we've been using Withings devices, both for weight monitoring and then also blood pressure monitoring. So it's really, the type of vitals that you would get, from a traditional visit, but ones that we might potentially, because of the efficacy of at-home use, now we can look at things more longitudinally. So that those are the devices that we play with.
Great, thank you. Someone else, I think Emily Halpert asked, how do you feel that modern wellness devices are better than traditionally used practices?
Sorry, ask that again.
Or how the new wellness devices, how are they better than traditional practice used in the past?
Yeah, so that's a great question. I think, we, initially when they first came out, I thought this was really interesting in conversations that I would have with practitioners. Like ultimately, all they were doing is really creating a digital artifact for things that we were already doing, right? And so, and I guess admittedly, some of the devices that I just described in the last question would be part of that, right? Like, so, wireless scale isn't really creating a better experience than the traditional scale. All it's doing is allowing us to have a somewhat accurate artifact over time but you could do that in an Excel sheet if you wanted, right? Oftentimes, if we're talking about the history of activity trackers, I mean, that really goes back to Galileo, right? I mean, it's not like these things are new technology. So what really does excite me, we didn't get into it in the conversation yet, are devices that are creating a closed loop system. So they're devices that you can use for sleep, that are paired with an app. And so it's not just monitoring your sleep, but for instance, if you're snoring, it will create a vibrating signal and wake you up, so that hopefully you can train over time, your ability to not snore. Or perhaps, you roll over into a different position so that, so it's those types of things. You're also, again, going back to the advances in ultrasound, are you going to be able to start to wear smart gear so that ultimately, you're doing a 5-mile run and the closed loop system of, that particular device says, hey, look, you've now depleted your glycogen, either go into, remediate to a walk run, or just call it, quits for today if you happen to be at a gym, so you can turn off the treadmill. So I think, to answer that question, 5 years ago, I might have had to kind of stumble along because a lot of the devices were really just, adding a digital component, to create data artifacts. But now we really are seeing, these closed loop systems where the device not only is, tracking, but it's also being able to, yeah, exactly. And then you're also seeing, I'm not the only one, talking about, better usability. And so one of the researchers that I've been following quite a bit, she's out of Duke, named Jordan Etkin, is looking at the ways that these devices were created, were really driven by engineers. And so they're data rich, right? You get into the user interface. I think about my old Garmin GPS watch, right? And the whole thing looked like, I was about to fly a plane, right? But ultimately, most users really just want to know, again, back to contextual relevance, what they need to know, right? In fact, Dan Ariely, another gentleman out of Duke, is creating a scale, where it doesn't show the weight, because we now know over time, like, people can perseverate on, that number, which isn't really helpful with regards to health and behavior change. You really just want to know directionally if you're going in the right direction or not, right? So, there's two aspects: these closed loop systems, but then also these devices that are able to present the data in a way that is so useful for the end user, that through the use of technology, it's a much better tool than it would have been in its analog form. But we're just getting there. So that's a great question.
That's great. There is a few more that are really interesting. One of them is Ray Edwards asked, what do you think every healthcare provider should recommend for wellness strategies? I know it's broad, and of course it may change.
No, but I have a bias, so I have a place to start. I'm at,
okay.
Yeah, but it goes back to, we're looping back to something that I thought was very timely, coming into this webinar, and that is, especially, these considerations of making sure that we don't stigmatize the patient, but that we also identify the fact that things like keeping people active are helpful, right? And so, one of the places to start is by looking at the physician's ability to believe and administer things like physician-referred exercise program. We call it PrEP. And unfortunately, the barriers for that particular type of intervention are the same as much of the rest of what medicine faces. And that's the fact that we're still stuck using a fax machine, right? And so even if a physician wants to prescribe something like exercise, because it's medically relevant, it still falls under HIPAA. And so the ability to communicate with an upstream provider has all the same shortcomings as they would, and interacting with any other provider. And so there are technologies coming online that are trying to build that bridge and become middleware to make it a lot easier for physicians to be able to, if they choose to, in an efficient, scalable way, provide that type of prescription. So we're using a platform called Weld, that's WELLR, which creates a medical wellness record. So where an EMR is really meant for specifically for patient data. This creates sort of a safe space for more longitudinal data, and can create that safeguard with regards to what I discussed, with regards to piping in that cardiac intervention data that could potentially put the physician at risk. So I think because we do know that fitness and activity is one of the best medicines, getting physicians more in line with that, more comfortable in prescribing it, and creating a bridge between upstream providers and traditional care providers is extremely important.
Now, I think you've alluded to mental health issues, and so have you seen some digital health applications or tools that are specifically designed for mental health?
I have. The one, and I played with a lot, I think the one that I have the most intimate knowledge with is Ginger.io. So that's one to take a look at. I think there's some hope there. I've looked at some of the research coming out of USC, and I think what's really interesting is that there are a few things, right? One of the best interventions with regards to mental health, in addition to my bias for fitness, is cognitive behavioral therapy, but that's one that really needs to be learned by a practitioner, right? And so you've seen different health tech innovators try and scale that, but I think ultimately that's, we're still in a work in progress, because, the need for human intervention versus being able to scale that through just some sort of machine learning feedback, the jury's still out. What we do know about automating that through technology is a lot of people are willing to if they believe that it's not another person on the other end. Again, this research is coming out of USC, that people will disclose more. And so with regards to assessments, people are actually more honest when they believe that they're being assessed by a machine rather than a person. So I do think there could be a symbiotic relationship between the two, but ultimately when it's completely technology driven, it falls flat. But that's another good opportunity to talk about virtual health, because we kind of danced around that but never got into it deep. And I think I had already disclosed that I had insomnia during the pandemic, and I couldn't find a CBTI trained psychologist in the Triad where I live in North Carolina. And so ultimately it was because of the access to telemedicine that I was able to find a CBTI trained psychologist that was able to see me, because that was made available, and opened up during the pandemic. And so one of the hopes is that access to care through virtual, whether it's telemedicine or virtual health, remains open, because that access to care and the ability to scale through virtual health is extremely important. And it also, for someone that truly needs mental health care, I think it also reduces the stigma, right? Because I certainly, have personal anecdotes with friends that probably waited a little too long because they didn't want their friends to see them going into a psychiatrist or a psychologist's office. And that's another thing that digital health really is able to give that intimate experience, so that someone can get the care they need without feeling like they're going to be stigmatized.
Right. Now here's another broad questions, and of course it's from your perspective, because how challenging do you feel it is to being a healthcare leader during this ongoing global pandemic? And I'm sure there is many different perspectives, of course, because healthcare leaders can be many different types of people, from providers to innovators to people like yourselves who are thinking about it.
Wow. Okay.
I know it's a tough question from your perspective.
No, but it's one that I've given a lot of thought, and I think I'll answer it kind of stepping outside of myself. I mean, I have a small role and humble role to play in all this, right? But I do think you've seen a lot of news articles come out, one about transparency with regards to pricing. So actually it plays in nicely to, the paper, that you asked me about earlier. I think what we're exposing is that it's a really complex issue, right? And so, for the most part, all of us that get into this space, anywhere along the continuum of care, do it for the right reasons. But at the same time, a lot of hospital care and wellness care, for that matter, is profit driven, right? And so I think we're starting. There's so many facets of this that we're trying to take stake in the fact that we want to make the biggest impact that we can, but at the same time, they're profit centers that are getting eroded, and that we've seen a lot of hospitals have really bad years in 2020 with regards to economics and things of that nature. But it's also exposed that there are huge profit centers in some areas that are basically stealing from Peter to pay Paul, so that you can offer stuff at more affordable care. And so I think as leaders in the industry, it's kind of this day of reckoning of like, where do we really lie with regards to our own ethics, and to what extent we do want to be more profitable. What does that mean? And so I think we do need to be more transparent. So I'm talking specifically about price sharing and things of that nature. I'm a little bit frustrated that that's taking longer than it should. But then also, I think it's a two-way street. One of the themes of today's call has been partnership, is understanding that a lot of, let's say like an MRI, is an expensive thing at a hospital because traditionally that was a profit center. Those expenses that are being covered by payers really do help finance a lot of, the crisis care that they provide, within the community. And oftentimes we'll, use a reductionist view to be like, okay, well, this is terrible, right? But we're not really looking at the whole picture. So trying to build that bridge so that everyone sort of understands the problems, so that we can work at, it's not going to be easy, but it can be a more democratic process with regards to, how to rebuild things as one, since this is a health technology webinar, as health technology really is disrupting some of the ways that hospitals made money, but then also figuring out, as we're able to rebuild and also take advantage of some areas where technology is improving things, how can we create a more collaborative system where, everyone, up and down the chain feels like it's collaborative and a partnership.
Thank you. I think this was very thoughtful. It's a very complex world. There is so many complexity. And I really appreciate your answer. Thank you. So we have a few minutes, and so I have a thought. Number one, I want to thank you for your contribution today. Also, on our own website, it's www.osplabs.com. We share a lot of information and webinars and white papers and ebooks. So feel free to visit us. And maybe you can share also how people can reach out to you, and maybe also share your last thoughts. We have another 6 minutes. We certainly can go over, but if you don't mind sharing a little bit, maybe your last thoughts, and then share a little bit more how people can reach out to you.
Yeah, sure. Thank you. So I think well, one, I'm grateful for the opportunity to share. So thanks for having me on. I do think we're at a point where, especially with the younger generation, Gen Z and millennials are starting to understand that, advocating on their own behalf and being, sort of the champion of their own ship, puts us in a place where we can create services that are more supportive rather than, where we're taking care of conditions. So my hope is that, we can all work together so that we are expanding the continuum of care and not really thinking about people as patients, but more as people, and starting at a place where we're thinking about them first and how to cater to them. With regards to how to find me, again, the company is Active Wellness. So you can find us on activewellness.com. And then if anyone is interested in social psychology and the book, which is sort of off topic, but just in case anyone is, again, The Fun Habit is coming out in June 2022. And my personal website is michaelrucker.com. And there's bunches of ways on that website where you can reach me if you want to talk about any of these topics. And I'm also available on LinkedIn for anyone that wants to connect after this, and happy to discuss any topic that we've gotten into this hour.
Sure. You cut out for a moment. Can you repeat again how to reach you?
Yeah, so my website is michaelrucker.com.
All right, that should be good. Well, again, thank you very much for all our people who participated and listened and will listen. We will basically we are going to, we've recorded this session and we're going to make it available to people who couldn't make it today or had to leave early. And again, Michael, thank you very much for your contribution. We really appreciate it. And we look forward to more webinars, and we wish you the very best. So everyone, thank you very much, and have a safe and wonderful week. So thank you very much.
Thank you.
Bye-bye now. Thank you.